Hi, welcome back. I wanted to do a video of an abdominal x-ray with you and kind of go through some of the anatomy. All right, so we talked about where that the liver sits on the right side of the abdomen, the spleen sits on the left side of the abdomen, the ascending colon sits on the right side of the abdomen, the descending colon sits on the left side of the abdomen. The sigmoid colon kind of comes back more towards the middle of the abdomen, and the rectum is in the middle. So we're going to look for these different structures on this x-ray. I also want to talk about the psoas muscle, which is very important on our x-rays. If you look at the drawings out to the side of the x-ray, you'll see an x-ray of a full skeleton that shows you the large intestines, the liver, the part of the stomach, and the small intestines, and then the bladder down near the symphysis pubis, which is, remember, the symphysis pubis is in line with the greater trochanters of the femur down there. So if you can look at those structures, put into perspective where they sit in the abdomen. Look at that big fat liver up underneath the ribs there on the right. Okay, the majority of the liver lays on the right. Now the picture right next to it is just a picture to show you the psoas muscles. The psoas muscles are these muscles that run from the lumbar spine, right? So they project off of the lumbar spine laterally and kind of lie in a kind of like a little diagonal shape and run all the way across the hip joint to the femur. So these are important muscles for us because they're a thick muscle that is all the way posterior in the body, behind all of the structures we see on the picture, the drawing that's right next to it. We've got small intestines, we've got large intestines, we've got kidneys hidden behind there, we've got a stomach, we've got a liver, right? We've got a lot of soft tissue, fatty tissue, more muscle, ligaments, integumentary system. Like, we have all of those things all superimposing those psoas muscles. So if we hit the patient with a central ray that's anterior posterior, meaning it enters the anterior and exits the posterior, to know that we've penetrated all the way through the patient, all the way to those psoas muscles, we'd be able to identify the psoas muscles on the x-ray. So that's one of our challenging things to do, is find the psoas muscles on our x-rays to make sure that we've penetrated all the way through. Now, what's right next to the psoas muscles? Or what do the psoas muscles come off of? The spine. So it's a good indication that if you can see the spine and the spinous process is down the middle of the spine, hello, that's what we're seeing here in this x-ray, then that means we've penetrated all the way through the abdominal contents all the way to the spine. All right, so that's another indicator. Now the psoas muscle is where it gets a little more opaque. Unfortunately, this, where I'm going to highlight the anatomy on this picture, they don't highlight the psoas muscles for us. So I have other images that do highlight the psoas muscles. So we'll look at those together eventually. I have many pictures of psoas muscles on my PowerPoints for class 2. So let's highlight some of these structures that are superimposing each other one by one. All right, let's see if I can kind of just see if I can get just to the liver. There we go. Okay, so now shaded in blue on the right side of the body is the liver. This liver intake gives you a note down here saying the liver usually doesn't extend below the lower pole of the right kidney. All right, so this liver lies a little bit lower than normal. It's okay. It's just a variant of a different shape of the liver. The liver is mostly on the right side though. All right, but we do see it crossing over. It does go over into the left upper quadrant on the left side a little bit. And then we get to the spleen, right? So over here on the left, that other structure, that other blue structure is the spleen. So liver and the spleen most superiorly. This gray area right above the liver and the spleen is the diaphragm. And then the black part is the lungs. All right, so working our way from superior to inferior, we could see the, the costophrenic angles of the lungs, the cardiophrenic angles of the lungs that we talked about in our other video. We can see the diaphragm. Now we can see the liver. Now we can see liver on the right, spleen on the left. All right, so now let's try to find those kidneys. There they are, highlighted in yellow. See how they're superimposed? This kidney, the kidney on the left, is slightly superimposed by a little bit of the spleen. The inferior part of the spleen is superimposing a little bit of the upper pole of that kidney. The right kidney is, a lot of it is superimposed with the liver. All right, so if we, take away the highlight, now we can, you can kind of see it a little bit better, right? That left kidney just eludes me. Every time I take the highlights away, I'm like, where did the left kidney go? That one's tricky because it's covered, superimposed with gas that's in the descending colon. So we'll look at that. We'll highlight those structures too as we go. All right, so here, kidneys, right? So now we have kidney superimposed by descending colon. That's all that black is. That's not in the kidney. It's just superimposed over the kidney because they're laying in line with each other in the body from anterior to posterior. Remember, the kidneys are in the back. All right, so then let's highlight, I think we're getting into colon. All right, so here, this is the large intestines. This is where the cecum lies here. So this is the ascending colon. Ascending colon going across the midline. It doesn't look anything like the picture of the skeleton to the right over here, where it shows the ascending colon going straight up the right side and then makes a very definitive curve across the belly to the transverse process. It doesn't look like that in this x-ray, but guess what? It's everyone is different. Every body is different inside. There's a potential movement of our transverse colon, so it allows it to move around as we lie on the table and roll around for different x-rays. So yes, it does not look anything like a drawing that you've learned anatomy on. So that's what makes it challenging. That's why anatomy is so important to understand what's on what side. What is more medial? What is more superior? What is more inferior? And what is more lateral? So far we talked about structures that are more medial than part of this ascending colon. What did we talk about that was more medial? The psoas muscles. How do we find the psoas muscles? We know they're more medial, so we go straight to the spine and look for them diagonally from the spine. The kidneys are more medial than this part of the ascending colon, where the cecum would lie, right? And then the ascending colon comes up, and we know the transverse colon is more superior. We can look at this picture over here next to it and see that the transverse colon is more superior than the ascending colon. So this couldn't possibly be transverse colon, could it? It's ascending colon working its way into transverse colon. Does it look anything like the drawing? No. I'm sorry. No, it does not. I can't change what's inside our bodies. It is what it is. We got to get used to navigating the map by knowing where the different organs and structures of those organs lie in the body. All right. So ascending colon on the right side starts low and works its way high up to where the transverse colon would be. Then crossing over the spine transverse colon, what's going to happen here is a flexure that we can see very clearly on this side. We don't see the flexures here. There's a flexure here, the hepatic or right flexure. They don't even mention it in this little blurb down here because it's not clearly demonstrated. It doesn't look like a drawing would, but it is. This is the ascending. This is the hepatic flexure or right colic flexure. Hepatic because it's by the liver. Right colic because it's on the right side. Liver's on the right side. It all makes sense when you think of it that way. Then it kind of levels out here. Transverse colon, because yep, we have a transverse colon. It loops around up here. There's some superimposition here. So all of this is ascending, right flexure, the transverse colon. Splenic flexure is up high at the very top of it by the spleen, obviously. Splenic flexure on the left side of the body. All right, so let's see if I can highlight the rest of it. There we go. All right, you see this loop-de-loo that's happening right up there? Hi, I'm going to highlight, right? Okay, now watch. Watch when I connect the rest of the large intestine. Boop, you see that loop? You see the overlap? It's overlapping itself or overlying or superimposing itself. Because remember when I showed you the flexures, I had to turn that skeleton in a lateral so that you could see that the flexures, they curve posteriorly. All right, so the flexures curve posteriorly. So that's where you get that loop-de-loo and the superimposition. That's why we have to go in and do oblique x-rays to show you those flexures in barium enema x-rays, right? Because they're overlapped and superimposed on our plain abdomen x-rays. All right, then we follow that loop-de-loo to down the descending colon. The descending colon has some air in it, right? So they've highlighted the area of the descending colon, and then coming back over to sigmoid colon. The sigmoid colon brings the large intestines back medially, right? So the descending colon down the left side, sigmoid colon loops again. There's more loops in the sigmoid colon. And then working our way down the sigmoid down to the rectum. So here, right? So, you know, so you can see it doesn't look anything like a drawing where you learn the anatomy before, but don't shoot the messenger. Like this is real. This is real life. This is what's really inside a real patient, a real life patient that you may have x-rayed. So we have to be able to identify the area of these structures. As long as you know where those structures should lie in the abdomen, that will help you navigate, because every single x-ray on every single person is going to look different, because we're all a little bit different in our own ways. All right. So we talked about the psoas muscle and the penetration with the sufficient kilovoltage power to penetrate the patient's body. We can also talk about the symphysis pubis. The symphysis pubis should be demonstrated in this x-ray because the bladder, if you see over here, the bladder lies right there where the symphysis pubis is. So that means in this abdominal x-ray, may have clipped a little bit of the bladder. We have to include all of that. So we should be seeing the symphysis pubis a little bit, but we don't. I'm hoping, did we talk about the lungs? This is the lungs up high, then the diaphragm, then working our way down to liver on the right, spleen on the left. Then we hit those the kidneys. Then we got into talking about the intestines, the large intestines, and following the patterns of the large intestines. The ileum I'm going to talk about in more detail in another video. I'm going to be talking about the ileum, the right and the left ileum, and elongation of the right and left ileum in rotation of the abdomen. I'm also going to do, I think in the same video, I'm going to do rotation of the thorax and show you elongation and foreshortening of the ribs, to show you some rotational movements so that you can see how it will look on the x-ray and how we'll be able to identify what x-ray we're looking at by looking at the skeletal structures and the elongation and foreshortening and comparing the right and left sides. So I'm hoping that this video was helpful. Let me know if these videos are helpful. Let me know if you have any questions on these videos. I think I'm on your chat now. Yes, I am. I'm part of your chat now, so you can discuss these things with me if you'd like. So I'm just hoping that this is helpful, and thank you so much for watching, and look forward to doing the next video for you. Bye.